found compliant to the EAC minimum standards. This is therefore a call to all accommodation and facility owners and managers to register and get licensed by UTB as a requirement and get ready for participation. For more information, visit www.utb.go.ug or email qualityassurance@utb.go.ug for details. Uganda Tourism Board, promoting tourism together.
It's no secret that ICT makes learning easy.
The strides made in our field could not be possible without it.
And now we can watch our favorite show.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC.
Well, a very good evening. My name is Jagad Asemakola Ziksoka. Welcome to BC TV again tonight, and we just thank you so much for having been part of the bulletin that has just ended here. UBC Radio with Jetson Kasaiji. And now we come to say stage for His Excellency President Yoweri Kaguta Museveni, who is supposed to be addressing the nation in a very few minutes from now. Now, remember, this is going to be the second COVID address from the president since we got into the variant, or what we now call the second wave, according to the experts. And it is what we are. Of course, the problem is spiraling and seemingly getting out of hand. There are quite a number of challenges that we're enduring at a time as a people, but of course we wait to hear from the president. He spoke to us last week on Saturday, and he promised that he will talk to the scientific advisory team, and thereafter will tell us the guidelines of how to manage this second phase, which seems to be so terrible, and it seems like it's catching up on us. Now, in studios this evening, I have two experts, medical doctors, and of course very qualified, both of them with PhDs and outgoing ministers. Honorable Joyce Moriko Kaduchu, the outgoing Minister for Primary Health and Member of Parliament, representing the people of Moyo, not Zombo, of Moyo. Thank you so much. And together with Honorable Joyce Kaduchu is the Honorable Dr. Chris Bariomunsi, Member of Parliament representing the people of Kinkizi East in Kanungu district. Also outgoing Minister of Housing. You're very welcome. I'll start with you, Honorable Kaduchu. You're very welcome, and here is where we are. First and foremost, congratulations for your re-election. I've personally not met you again, formal and official like this, but congratulations. And of course, let's get to the issues. We are in a very bad situation now as a country, and we just need to hear from you what the situation looks like and what the people need to do right now. Welcome.
Thank you so much. I really, first of all, want to take this opportunity to thank the people of Uganda. I'm thanking the people of Uganda for adhering to the voice of the president when the president made a warning to the people of Uganda. That was a week ago. And to date, we see some measures that have been put in place by the people of Uganda, but that is not up to the standard required. And having said that, allow me honestly to say that at the beginning of this pandemic, the president of this country, informed by science, he put in place 35 strategic directives that has really made the country to be put on the map of the globe. And because of implementing those directives, we managed to suppress the viral replication. And by the end of August 2020, Uganda was really recognized globally among the countries that have suppressed the viral transmission, and we are the best in Africa. However, from the month, that was at the end of August, from the month of October up to December last year, 2020, the cases went really significantly up. Thereafter, from January up to March this year, we saw significant reduction in the cases of COVID-19. And from April this year up to date, the cases have really gone up. And the peak was at the end of May this year. But even as we begin the month of June, we see a lot of new cases going up. Now, the question is, Uganda is in the second wave of COVID-19. And the wave came with lots of characteristics. One of the characteristics is that it is spread rapidly. The spread is like a bushfire. Number two, the severity is terrible compared to the previous wave. It's really severe. The third characteristic is that the presentation is not as typical as the first wave. In the first wave, we see people presenting with cough, fever, headache, chest pain, progressively to difficulties in breathing, generalized body pain and weakness. But this time round, some people do not present typically with those characteristics. Sometimes some of them, they eventually lose the taste, the senses. They are not able to smell. Some of them cannot have the taste. They cannot taste that really taste either food or something to eat. Others present with headache. It's not really typical. And then the last characteristic is it has no discrimination. Previously, we see only the elderly, people with underlying medical condition, but to date, it has no discrimination, whether you are a child, you are a younger adolescent, you are a school-going child, it does not spare you at all. Now, the fundamental question that every Ugandan is asking today, why is the characteristic of this virus in the second wave like this? The question is why? To respond to that why, number one, the viral replication. The virus produces itself, what we call in a medical term, replication, mutation. So it changes the genetic material from the original form to other form. And that's why we are having wider spectrum of the new virus. And because of that, we have different type of virus, the variants we talked about. Then, of course, second issue is the environmental factors. Environmental meaning that the rainy season vis-a-vis the dry season. During rainy season, there is a high humidity and low temperature. And previous studies have shown that influenza virus, the peak outbreak is during rainy season. And we can typically see in Uganda, the rainy season basically from March up to June. Then another season comes in September up to November, December, but it varies because of the environmental destruction. So this environmental, especially the weather, affects lots of the outbreak. I want to say that studies have shown high temperature above 65 degrees Celsius. When the virus is subjected to that temperature, it doesn't survive. Within 3 to 5 minutes, it kills the virus. Meaning that higher temperature, the virus cannot survive. Now, during dry season, we are also seeing the benefit of vitamin D. We are seeing the benefit of vitamin D, which is an immune modulator. So these are the factors. And the last factors that probably lead to this significant increase in their wave 3 is the human behavior. Our behavior, the interactions that we have, our cultural norms, the socialization, and of course, when we are told to use masks, we do not use masks. When we are talking on social distancing, we tend to socializing. We tend to not improve on our hygiene. So really, all this you can see this second wave is something that every Ugandan at this point in time should get worried.
Dr. Baryomunsi, I want to welcome you. Thank you so much, Honorable Dr. Joyce Kaduchu. From a very successful story to where we are now, people are now starting to realize, because during the first wave, we were getting images from the rest of the world to actually try and show the people how bad this problem is, and we didn't seem to have any of those. Now, that's when we learned of things like asymptomatic. We had so many of these, and people were in isolation centers, in quarantine centers, and they were even filming themselves doing selfies and doing all the things to actually say, look at us, what is really happening to us? I'm here, I was told I'm COVID positive, and then it seemed like it was a normal thing. It's now catching, it's taking toll on us, and then we've now come to a point of realizing that yes, Dr. Kaduchu and Baryomunsi actually not politicking, but the problem is here. From a very successful story to where we are now, what we need to do better, that we do not lose this battle, and that our very good rankings of one country that has managed pandemic we would not lose that.
Yes, thank you very much, and I want to thank my sister for the good explanation she has given. As I go into what we need to do, let me also take you back to where we are coming from. COVID-19 is called 19 because it was confirmed at the end of 2019 in China, and then it spread all over. Now, on the 11th of March 2020, WHO announces, first of all, at the end of February 28th, WHO says this is a disease of public health concern. 11th March 2020, WHO again says this is now declared a pandemic, and it's spreading like bushfire. Now, 18th of March, the government of Uganda, through the president, announces a number of measures. By then, we hadn't even confirmed any case in Uganda.
We didn't have any case.
That was 18th March when the president announced the 35 or so measures to be followed by all of us in this country.
And amazingly, there were just about 5,000 cases in the world.
In the world, yes.
Just about only 5,000 cases.
On the 21st of March, a few days after the announcement of the president, we confirm one gentleman at the airport who is returning from Dubai, and is confirmed COVID-19 positive.
So that's how COVID comes into Uganda.
Now, there was a lot of scare, yes, that's how COVID officially enters into the country. But we mount a serious campaign. The response is very good. The measures are announced. The scientists then did what we call scientific modeling, modeling the epidemic, to say, if we do not do anything, how will the situation be in a number of months to come? And it was worrying. The cases which were expected to hit us were quite many. But Ugandans took heed of the guidance of the president and the government and adhered to the SOPs. And we took up masks, we took up hand washing, social distancing. So through the months of March, April, May, you recall when we were giving out food in Kampala and Wakiso and the lockdown. So there was effective implementation of the measures which had been announced by government. And we managed to control this pandemic. And what we saw those days were death and the devastation, especially in Europe, in America, in Southern America, in countries like Brazil. It was just terrible. While here we managed to control. Along the way, we brought down this pandemic, and like Joyce said, at the end of last year, we even had recording any cases, even earlier this year, any cases of COVID. You recall the president even the other day when he was talking about the surveys going on, the therapeutic surveys going on. The scientists were failing to get cases to try some of these drugs they are trying. They are trying to do research on. Now, what has caused all this? But now the situation has changed. In my view, first of all, complacency came in. People thought we have overcome the challenge of corona.
That's what we thought.
Yes, a number of Ugandans.
That we had managed it, we had overcome it. And
they moved away from the measures which we had taken on. Because while the government tried to give masks, free masks to Ugandans, you go up country, I usually challenge people who come to greet me. Somebody comes to greet you as an MP, he has no mask. When you say, where is your mask? He pulls it from the pocket.
They have them.
And puts it on, yes. It's used as a handkerchief now. Or somebody is putting it on as a necklace. You go to functions. Initially, for instance, the guidance was, the churches were initially closed. When they opened, there was a guidance on the numbers. The burials, funeral functions were supposed to be scientific, but all this has collapsed. When the markets were opened, but with the guidance that they observe the SOPs, I think they went back to normal. You just go to Nakasero market, you go to Owino, life is as normal as it was. You go into the taxis, people are traveling as many as the taxis can carry. So there was a breakdown in observance of SOPs, and then also, of course, you add in the coming in of variants. Of course, initially we had closed the airports and the entry points into the country. Now, when they were opened, I think we didn't put stringent measures to check those who are coming in and going out. And then this is how these variants cross from other countries into the country. So you have a combination of the non-observance of the standard operating procedures because of the complacency, and then also the setting in of the variants being transported into the country, and then you get this mixed picture giving rise to this second wave, which is giving us a lot of a headache as a country. And therefore, as Ugandans, we have to think twice now. We have to get back to our SOPs because they worked and they work. Because COVID-19, yes, is a dangerous disease, but a disease which can be managed, especially if we observe the measures which Ministry of Health and experts guide us on. We can control this, this disease.
Dr. Kaduchu, when we first got the surge coming to the country, we were not very prepared, I can say. And when we locked the country, we did a lot of things. We put up a lot of measures away from what we're supposed to do, the SOPs. But government tried to do its best to ensure that the different health facilities across the country, the different regional hospitals, facilitated, fully stocked, and to prepare for this. And after all that, we didn't see we kept asking you, the doctors, what happens now? Do we have ICUs? What happens if people get to the CIs? I think at some point we wanted to see people get into ICUs and maybe HDUs, and it didn't come at that time. Here is where we are now. Are we much more prepared for the problem? Just analyzing and looking at the problem as it is now, are we in a position where we can now say, yes, if the problem is here with us, but we think as a country we are a little prepared to manage it? This is for both of you, doctors and of course leaders in government.
Yeah, thank you so much. Before we could talk about our level of preparedness to manage these cases of COVID, because as of now, we see quite many cases of COVID. Everybody has accepted and admitted that the hospitals are really overwhelmed. But what I want to say is that at this point in time, every Ugandan is asking a very fundamental question. When is this COVID coming to an end? But in line with that, what we should know is that we are not living in the normal, usual situation. This is an abnormal situation. It's like a war battlefield. And we need to devise mechanism to live in this situation. Because we do not know when it is coming to an end. We cannot say that, yes, well, let's get prepared. Maybe tomorrow it will end. But in line with that, what is it that as Uganda is going to help us really to see that this infection rate is slowing down or the virus is coming to an end? One critical issue I have to talk in this point in time is that for us to see this virus slowing down, to see the virus coming to an end, there must be a very big proportion of people being immune to the virus. We need to build immunity, proportion of people to be immune. This is the only way. There is no magic. If a huge proportion of people are not immune to this virus, then we cannot really slow down. And this required a proportion 60 to 70% of the population to build immunity, meaning that this immunity of the huge population will offer indirect protection. And this indirect protection to the population is what we prefer to the herd protection or population immunity or herd immunity, such that the huge number of people who are immune can protect those who are not immune. And this brings us to the phenomenon of vaccination. For us to get this herd protection to the community, to the population, there are only two ways. One of them is for the population to be vaccinated, which is the only safe, effective, and protective measure. That means if we can vaccinate quite a big number of the population, 60 to 70%, then the second option is to subject this huge population to infection. They get the infection, they recover, and they build immunity. And of course,
we subject them to infection.
That is the second way of building immunity to the community.
The first is the population.
The first is
immunity.
the vaccination.
Vaccination.
The second is subjecting the population to the infection such that they recover and they get immunity. But that one is not the safest, and WHO does not recommend, because how sure are you that they are going to recover? This is going to subject the population to unnecessary death as it is now. So the best option is vaccination. That means we need to vaccinate our people. A case in point is Israel and other countries that have reached almost 50% of vaccination. But now the point comes, in the absence of attaining herd immunity to our population, what is it that we can do? That is the point where you're asking, and where we are. Are we prepared to handle this huge population of people who are infected? Is our health facilities ready? Is the community ready to handle the people who are not severe? And I want to tell the people of Uganda at this point in time that yes, the first experience that we went through, the first wave, and I want to believe, and I want to make this categorically clear, that this has built the capacity and it has made our healthcare system a little bit resilient. And we put in place a robust healthcare system. All this has been done to strengthen the health system. But remember, when we have too many in the health facilities, surpassing the capacity that is supposed to provide, then we overstretch whatever we have put in, the human resource and many others, then at the end of it, we lose very many people. So in terms of the readiness, yes, we are prepared, but the preparation is of course not for everybody to fall sick. But our emphasis now, yes, government has got a big role to play in terms of really, first of all, offering leadership, which the president is going to offer at this point in time. We are going to listen to him. Two, is our health facilities to manage the severe cases. Then number three, the role of the community and other people. What is it that we are going to do as community? When somebody, we need first of all to be really vigilant. We need to be alert. We need to monitor the signs and symptoms. If somebody senses that I have headache, I've lost my smell senses, I cannot smell, I cannot taste anything, please be suspicious. Have really that index of suspicion. Straight away you go for test and subject yourself to community management. Because I think the ministry has given a guideline for community care so that people can start immediate care. So that is, I think, where we are now moving. And of course, apart from the medication, there are other things that we can do to keep alert, to keep fit, to keep physically fit. Our diet, our physical activities, and those that are probably those that with underlying medical conditions, which we need to put attention to, and importantly, the children.
Thank you very much. Dr. Bariomunsi, when the president was moving to unlock the country, he talked about personal responsibility, and it said I shall not stop you from dying. I'll not stay here to say, please don't die, don't die, don't die. Now, especially when you talked about our index COVID case was in March, then our index COVID death was actually in July. I think 21st or thereabout, when we lost a health worker from Namisindwa. She was the first case that we registered as a death case. And so we moved into a level where the president now allowed that we shall have to take personal responsibility, having told us everything they are in that we need to observe to ensure that we actually save and manage ourselves. Now, you notice that Ugandans are a very social people. That we are people who love socializing. We are into weddings and kwanjula every weekend. We are into burials. We are into churches. We are into mosques. We are into merrymaking. And in a way, we illegally, we also sneak and go to the bars, sneak and go to pubs and all the things. Do you look at Uganda now as though people can now get back to where we were in April, May, and possibly June last year? Is it possible that people can actually get back to the ways of April, May, June last year?
Yes, I recall appearing on this show when the president was saying, okay.
Last Saturday.
Or even before.
Or even before.
When the president lifted most of the
exactly.
SOPs, and then he said, now take personal responsibility. I have done my job. I remember quoting the book of Ezekiel in chapter 33 where
exactly.
talks of
I have told you and your blood is not
a
going to be
watchman. That the role of the watchman. That if a watchman sees a problem ahead, an enemy ahead, and refuses to tell his people, and if they die, their blood will be counted on the watchman. But if he tells the people, and
he shall have saved himself
he will
from
have
their blood.
absorbed himself, done his part. Even if the enemy kills the people, you won't blame him. Similarly, the president did his part. But I think, like I said earlier on, comprehensive setting, the personal responsibility which he and the government advised has not been heeded to adequately. And the people have behaved as if COVID had been defeated, and that's why partly we are where we are now. And therefore, to answer your question, I think Ugandans maybe we sometimes need some carrot and stick combined together in order to observe some of these issues. Like there's supposed to be a curfew. It has never been lifted. But both those who are supposed to enforce and us who are supposed to observe, we have all forgotten about it. So not until the police and the security comes in to enforce, that's when people will realize, oh, the curfew is on. We even had a debate on in the parliament, where members of parliament were saying, lift the curfew, and we're saying, no, we have not yet defeated the COVID.
And the issues there were, do you want to say that COVID is transmitted in the night, alone, because if you have curfew in the night?
The purpose of the curfew was, in the night, you are not able to see the gatherings. People can gather somewhere and you may not be able to detect. But if you limit movements
in the night,
then you are sure the bars won't be open, those gatherings won't take place,
night prayers,
and you are able to control. So going forward, I think the things which we have to work on, and I hope the president will be emphasizing some of these issues, is that we must go back to the SOPs, the various measures which were announced on different occasions by the president. We must now look at implementation and enforcement. Gatherings, both outdoor and indoor, have to be controlled. Should Owino market, Nakasero market, and these markets continue to operate?
Just as you can see on screen, people are transacting, people are doing business, and nobody seems to be caring.
So we have to look at these gatherings, both outdoor and indoor. They have to be now restricted. We give the numbers and SOPs. I remember that time I used to go to Nakasero market, but they wouldn't allow you to enter without washing your hands with soap and also putting on a mask and all these measures. But now you move, there is no washing or sanitization. Even if you have no mask, nobody will bother. So the leadership there has sort of collapsed. So we have to revive all these measures. The taxis, the public transport, all these issues. The schools, when we opened the schools, I think the management and leadership of schools also didn't adhere to the guidance which had been given. That's why you have seen many schools having our children contracting COVID-19. She talked of vaccination. I think the mainstay of controlling this COVID-19 as of now is to vaccinate as many people as possible in order to achieve
67% is about 28, 29 million
herd
people.
immunity, which he talked of. Herd is H-E-R-D, like a herd of cattle. When you vaccinate or when you expose a big proportion of the people to this, either the virus or the vaccine, and then they develop this immunity, then the 60 will protect the rest who are not exposed to the virus or to the vaccine. So we so far have vaccinated very few people. You recall even when we introduced the vaccine, there was skepticism in the public. Many people who were eligible to get the vaccine were shunning vaccination.
Exactly.
Not until recently when they saw the second wave has come in, people are dying massively, people now started lining up for this vaccine. Even those of us who got vaccinated, we also started behaving arrogantly by thinking because I received a jab, I can move without putting on a mask. I can recklessly live.
And that's what people talk about, Dr. Mariam. Exactly.
Yes.
I had planned to ask you the same question. That
Yes.
when somebody receives a jab, now those who have even had the second jab,
Yes.
why would they again put on a mask? Why would they sanitize? Why would they all do things? Because people think that once you have the jab, then you are safe from the problem. You do not have to again follow the SOPs as we talk about.
No, the jab gives you protection, but we still advise that you must follow the SOPs. Simply because there is still a risk of even you getting infected. Although, of course, the biggest protection is against severe disease and death. But you still run a risk, especially in the advent of variants circulating around. So we still advise from a medical standpoint that even when you have received the 2 doses, you should still wear a mask when you go in the public. You must sanitize, wash your hands, keep social distancing, observe these measures. Because in any case, those who are vaccinated are still very few. The virus is still saturating in the population, and therefore you still have to observe these SOPs. But what has happened, some of the people who received the injections were now thinking, oh, they have received the vaccine, so they can do whatever they want without observing the SOPs. And I think going forward, the government and all of us must mount a strong and robust communication strategy in order to continue informing and sensitizing Ugandans.
Okay.
As
But
we embark on these measures.
literature says
Dr.
individual
Kaduchu,
protection.
I'm just being told that the president, I think, is ready to speak to us. They're playing the anthems here. I'll just request that we get to where the president is, then we'll return after the president has spoken to us.
Okay.
Countrymen and countrywomen, greetings to all of you. I'm here tonight to address you on the issue of COVID-19 in the country. Since my last address on COVID-19 on the 29th of May 2021, the COVID-19 situation has drastically changed for the worse. It has not changed for the better, it has changed for the worse. On the 4th of June 2021, that is 2 days ago, the country registered the highest number of cases in a single day. These were 1,259 cases out of the 7,424 tests done. Now, that was 17%. 17% positive rate. That means that out of 100, 17 people have corona now. That's what it means, almost 20%. There has been an upsurge in case patients since end March 2021, following a 3-month period of January, February, March 2021 of controlling the pandemic. That time, we had controlled the pandemic so much so that we were really short of patients. You remember the other time I told you about the medicine we are trying out. That time, we didn't get people to try the medicine on because the corona was under control because of the good measures we had taken before. Currently, there is a diffuse and sustained COVID-19 transmission in 81 districts, where the highest burden districts like Kampala, reporting an average of 500 cases per day. Kampala is the highest, 100 cases per day, followed by Wakiso and Gulu, which have consistently reported over 100 cases per day. There is the map there. They can show you the map. The purple, that purple, like purple. It's red, deep red, but like purple. You see there it is Kampala and Wakiso. And in the north, it is Gulu. The blue or green, in this case, are they green or blue? Those are the ones without cases now, the green ones. The yellow ones have some cases. The white ones, are there white ones? They are where there are no 1 to 20. So the green one, green, blue, I don't know how they look. Are they blue or green? The green ones are the ones without cases in the last 14 days. But Kampala, Gulu are the worst. As of today, cumulative cases, as of today, cumulative cases, all cases from the beginning, stand at 52,929. Reported confirmed death are at 374. And those who have recovered, 43,487. Currently, we have 634 patients. The ones who are severe are 277, and those who are critical are 37. These are all admitted at both public and private facilities. This means that only 8% of the confirmed cases in the last 14 days are on admission. That's very, very interesting. You hear that every day, like today, we had 1,259. That's what we had today, just in one day. But in the hospitals, we are talking of 634 together. The ones of today, the ones of yesterday, the ones of the day before. So that means many people are not in the hospitals. They are not in the hospitals. They're in their homes. That's what it means. We are concerned that this will exhaust the available bed space and oxygen supply in hospitals unless we constitute urgent public health measures. Public health measures are okwekingira bwe tugamba okwekingira kusinga abaganda mugamba muti atwini okwekengera kusinga okuziyiza kusinga okuwona nyankeru okwetantara kukira okuraguza. Prevention is better than cure. That's what we mean by public health. You know, these people use words which they don't want you to understand, because if they understand, then you will know as much as the doctors. So the doctors want to remain as mysterious as possible. So they say public health as if you are. Public health means prevention. They should simply use the words preventive health. If they say preventive health, even somebody from Raktora will understand it. So therefore, the answer is prevention. In this wave, the intensity of severe and critically ill COVID-19 patients and death is higher than what we experienced in the first wave of the pandemic. In the previous wave, it took us 3 to 4 months to get to the current state of critical and severe patients, while in the second wave, it has taken us less than 2 weeks to get to the same situation. At the beginning, it would take like 4 months to get the numbers we have got now. But now, within 2 weeks, we have got more numbers than we got in 4 months previously. There is a graph which they should show you. There you are. The Kasoria, the peak, you see that one. That was in December. And then it came down, flat. Now, ngatu genze banani. We have now passed the other one, and we are still climbing to the mountain of danger. The most affected age group in this current wave are the young people, aged 20 to 39 years old, with observed increasing transmission among the 10 to 19 years old. Because when the problem started, there were the belief was that the group in trouble were the constituents of Jidudu. You know, we have got our honorable member of parliament for the aged. It's called Honorable Jidudu. And there are some old women in parliament there, the one with gray hair from Kampala area, and Mavenjina from the north. That constituency of ours, of the 65 and above, are 3.3 million people. But this time they had been joined by the ones of 50. Even the ones of 50 were supposed to be in some danger. Those were the people supposed to to be attacked and affected severely by this virus. But this time, because of the mutation, because the virus has changed, the new types are attacking the young ones also. So it is becoming a real problem. Now you show them this graph here. Now there, that tall tree you see, the tallest in the middle are the 30 years and up to 39. Those are the ones who are affected, who are now infected most. The runners up, the ones who are next, on the left, on my left, are the 20 to 29 years. The third ones on the right are the 40 to 49 years. The number 4 on the left are the 10 years to 19 years. Now, my constituency is the one now which is the less affected. I don't know why. I think because they stay at home, they don't move so much. That must be the reason. Gidudu's constituency, the one on the right is 50 to 59 years. They are less. The 60 to 69, much less infected. The ones of 70, very little. It seems they run away and hid in their homes. And the one of 8 is almost zero. So the whole thing has changed. So if one wants to know, bring back that graph, bring it back. If one wants to know how this virus goes, there you have the answer. The more you move up and down, the more. The Gidudu's constituency, the ones who have gone in hiding in the villages and in the homes, much less affected. So therefore, now the next graph is showing you the people who are admitted in hospitals. Show us that graph also. The ones who are admitted, there you are. The tallest again are the 2029, then 3039, then 40. Again, they are the ones who are admitted most. But the red ones are the ones who are critical. The ones who are critical. The green ones are the severe. These graphs will be published in the newspapers. You'll be able to see them. From the recent data on projection, this situation is expected to further escalate as a result of A, poor compliance by the population to follow the SOPs and my directives. That's the main reasons. Obujemu. Nantabulirirwa bwetugamba. Nantabulirirwa yasabala n'ababumba. You remember I told you that in my Uganda the other time. Somebody was told, please, clay does not make boats. Don't make a clay boat. He said, me, I'm clever, I'll make a boat out of clay. And the man went in, and when he was a few meters from the shore. The clay cracked and the man died. So this is the main cause. Poor compliance by the population to follow SOPs and my directives. You remember in the elections, people said that the reason we were stopping holding rallies was because we wanted to stop the Honorable Chagulanyi and the groups from organizing politically. You remember? And then the Europeans and all those groups. So now, you have now seen what congregating can do. B, there is an increased number of clusters of infections in schools since March 2021. You remember we opened schools. You remember last year I sent home 15 million children. And when those children were in the villages, I didn't hear of any infection. 15 million. I didn't hear of any infection. If it was there, I didn't hear about it. Now, when we opened the schools, that has now become a new center of infections. A total of 948 reported cases in 43 schools from 22 districts have been reported. Kampala, Guru, Masaka, and Oyam districts combined constitute 61% of the reported cases in schools and higher institutions of learning. We believe this number is much higher, only that most schools are not reporting. Some schools are hiding. They are hiding because they want to keep the schools open for money reasons, not for health, not for godliness, but for money. And you know how money caused the problems for Judas. Judas Iscariot. Money. So, children should die because of money. So some institutions are hiding. The high number of infections in schools is largely attributed to poor compliance to SOPs, inadequate sanitation facilities, in spite of the fact, you see, when we opened the schools, we said, let only the completers be the ones to come. We first allowed the S4s of last year and the S6s and the P7s. They went and sat for the exams and went out. Then we said the next group come in. So really, the people who are in school now are like 10% of the total potential school population. But still, and the logic was that they have enough space. They can social distance, they don't have to congregate. But some of the people don't care. Some of the people don't bother. So therefore, overcrowding in some schools. Failure by some school administration to monitor signs and symptoms among the learners and timely reporting. Remember we told you that when you see somebody with Senegal-like things, report. I have had, I don't know how many tests. Whenever I have like a Senegal, like an allergy, sometimes I get some allergies. Even these masks. You remember the other time my voice disappeared. It was this mask which caused that irritation of my throat. So sometimes it causes me some allergy. Like the other time when I went to Tanzania, I came back with some allergy in the nose, and I had to go for test. Do I have corona? I have had tests like 2 times, 3 times in the recent, because of when I have like a flu or like an allergy, I test for corona. But fortunately, whenever I test, I was negative. Because I don't want to if I have the corona, I shouldn't infect other people. I should stay in the home or in isolation. During the campaign, some young people around us here got corona. When I was about to go to Rukunjiri, I had to test first before I could go to Rukunjiri. I was in Extra. I would have had to change the mode of the campaign, maybe address the Rukunjirians through the radio and not go there. So we said, please, if you see any signs, test, report, and let them check. And then you can be able to isolate that person, then you save the bigger group. But if you keep it, if you keep such a person in the group, then instead of having 2 people, you will now have 100. And then concealment of infections in some schools by the school administrators. The entry of new variants that the Minister of Health first reported at the beginning of March 2021, in addition to the original Wuhan strain, Wuhan is the other Chinese one, have been noticed. The variant strains specifically, like the Indian variant B1617, the South African variant B1351, and the UK variant B117 are more aggressive and tend to cause sustained transmission and a shift of the most affected age groups from the older individuals to the younger age groups. This is because of the travelers that would come into the country with purported negative PCR test results, yet they were infected. To date, we have confirmed a total of 126 cases from travelers coming in from the airport. It is for this reason that the government, working with the private sector, instituted mandatory PCR testing at the airport. PCR is to check for the presence of the virus in the body, as opposed to antibody. Because some of the tests, you check the body reaction to the virus. But the PCR is when you look for the Mulambo, for the either Mulambo, the dead body of the virus, or fragments of it, or fragments of the virus. This is what these doctors want to keep you out of information. PCR is somebody in Rectora. PCR will think possibly you are talking about a nightclub or something like that. So they have put PCR, this looking for the the fragments of the virus at the airport for travelers from high-risk countries. The sustained transmission within the communities by infected persons who fail to adhere to the principles of home-based care. If you get infected and you go into your home, please keep away from your family and from others. You take one room somewhere in the house, say, Mundeke, don't come here, you people. Don't go in the sitting room to talk. Just isolate yourself for the sake of your family. The sustained transmission within the community by the infected persons who fail to adhere to the principles of home-based care e.g. strict isolation from your family, adhering to full-time use of face masks, even in the home. Here I'm not using my mask here, I have it. But because all these people have got a shankara, you know, the Nyankoro word for mask is a shankara, which we put on the mouth of the calf, not to suckle the mother. So since all these fellows have got a shankara on them, that's why I'm not putting mine so that I can speak better. So when you are in the home, and there is a case in the home, put on the mask all the time. Yeah. Adhering to full-time use of the face masks, hand washing, and no movement out of home until one is declared COVID-19 negative. If they do not adhere to the home-based care principles above, they pose a serious risk to the general population. There is generalized laxity in the response by most districts, resulting in several clusters of transmission. The district task forces, chaired by the RDCs in all districts, are the bedrock of the COVID-19 response. I'm informed that most of these task forces are not meeting to guide the response. Important to note is that since my last address on the 29th of May, a total of 6,308 new cases from 57 districts have been reported. Currently, 81 districts have high sustained transmission. These include Kampala, Wakiso, Gulu, Ruwero, Mbarara, Mbale, Tororo, Moroto, Masaka, Busia, Nabilatuk, Amuru, Lira, Moyo, Arua, Lamo, Karungu, Rubirizi, and Yumbe. This resurgence happened after government had developed some capacity to manage COVID-19 in the form of enhancement of skills and numbers of our human resources, installation of new intensive care units, high dependency unit equipment, procurement and installation of oxygen plants in all regional referral hospitals, procurement of ambulances for emergency evacuation of patients, and re-operationalization of Nambole to manage moderate to severe cases. So when this virus epidemic started, we started building capacity. So we have some capacity now. That's what I've been saying in this section. The current hospital beds to manage COVID-19 patients stand at 3,793 beds, as summarized below. Mulago National Referral Hospital, standard beds, 600. People can't read those. Don't waste time. I will tell them. Those are too small. 600 beds, standard. High dependency unit, 300. Intensive care, 27. Mulago Women's Hospital, high dependency, 60. Regional referral hospitals together, ordinary beds, standard beds, 900. Standard beds, but dedicated to corona. Dedicated to corona, not beds for malaria, for a chuduka, no. Those are also there. These are specifically for Akauka, for this corona. So the regional referral hospitals, 900 together. High dependency in the regional referral, 115. Intensive care units in the regional hospital, 150. Nambole, general beds, 1,300. Bombo Military Hospital, 120 standard beds, 10 ICU, intensive care units. Private facilities, 7 of them have been accredited. Standard bed is 180, intensive care unit 31. So standard beds for corona, 3,100. High dependency beds, 475. Intensive care beds, 218. In addition to this, government continues to mobilize non-traditional treatment facilities in the form of field hospitals to provide additional capacity for asymptomatic to mild and moderate cases. In the worst case scenario, should cases rapidly escalate and overwhelm the above bed capacity, government will install a 300-bed field hospital per regional referral hospital, thus providing an additional 4,500 beds. That is to say, if the problem becomes worse, then near the referral hospital, we build their tents and we turn them into temporary hospitals. So that will create an additional 4,500 beds. The current rise in the COVID-19 infections in the country can only be stopped if all the people of Uganda take personal responsibility for protecting themselves, their families, and communities where they live and work. You have seen that in the spread, Gidudu's constituency now is less affected. The elderly, because we told them, please, you stay at home. The other day I was when we were in Chankwanzi, I talked with one of the army officers there. I said, how is your mother? He said, I took her to the village because of the corona. So this army officer took his mother to the village to get out of the infection area. Okwewara, you will not get, to avoid congregating, you will not get the disease. So you take personal responsibility for protecting yourself. Uganda has well-established structures for coordinating and governing the population, such as LOCs in all the villages, culture and religious leaders, and organized groups such as taxi or border operators. We used these structures in the past to defeat HIV, Ebola, and other epidemics. So therefore, if you take responsibility for protecting yourselves, your families, and communities where you live and work, it can work. It is effective if you bother. In October 2020, the government launched the National Community Engagement Strategy for COVID-19 response, which has been distributed to all the districts in Uganda. This strategy has guided on how to establish village COVID-19 task forces across all the 146 districts and how to provide home-based care when needed. I call upon all district leaders, including LOCs, cultural and religious leaders, to use existing structures and systems to ensure that SOPs are observed in the villages and during village functions, and the village health teams are supported to mobilize people to report illness and support communities as guided in the Ministry of Health guidelines for home-based care and support. The government has vaccinated a total of 748,676 people across the country. 712,681 people, 712,681 people with the first dose and 35,995 with the second dose of AstraZeneca vaccine out of the 964,000 doses received so far. Government appreciates the Ugandans' enthusiasm to access the vaccine since my last address. 86,377 people have been vaccinated in a period of 7 days in comparison to 78,791 vaccinated in the previous 7 days. Government is committed to vaccinate all the 21.9 million eligible Ugandans, starting with the priority groups of 4.8 million people. These priority groups are the health workers, 150,000, teachers, 550,000, security personnel, 250,000, the elderly, all those above 50 years old, 3.3 million, and people who have other diseases like cancer, high blood pressure, diabetes, liver, heart and kidney disease, 500,000. Uganda vaccination and rollout efforts have been hampered by the global vaccine shortages and amplified by the resurgence of COVID-19 in India since February 2021. The other day at Corona I spoke about this, that's why I don't want to speak about it again. This situation in India, given its large population, has delayed the global vaccine delivery commitments to countries on time. However, government is making all attempts to ensure that we secure additional doses to cover all the targeted groups. Don't remove from TV because of taking my coffee, please. Fabagana tugamba nti akatali kabbe amagomba olya osula mu mulyango. These people don't know our culture. Nyade kaho yange nonkweka. Stop all this buyaism. This is my coffee. This is the lubricant for the throat. Uganda is expecting to receive an additional 175,000 doses for the vaccine through the COVAX facility. This is AstraZeneca. So please, you people, you vaccinate second round, the ones who have already. Yes, first finish those. Because if you don't, then that one will be wasted. In fact, I wouldn't want you to vaccinate new ones until you finish second round the other ones, so that we have that complete group. In addition, government will secure 300,000 doses of Sinovac vaccine donated by our friends, the Chinese government. But I want to buy. I don't want to depend on donations. We shall buy. We shall buy from Johnson & Johnson, the Americans, from these Chinese, and even from the Russians, the Sputnik. We shall get the doses. I would like to remind you all that COVID-19 control and prevention is the responsibility of everyone. I therefore urge all Ugandans to adhere to the COVID-19 SOPs, wash hands with soap and water frequently, wear face masks, social distancing, avoid mass gatherings, avoid touching your mouth, nose, and eyes. Avoid closed spaces. Open windows fully. Avoid crowds, markets, malls. Avoid individuals with signs and symptoms of COVID-19 or ordinary senyiga, cold. Avoid them. Ensure good health, physical exercise, good nutrition, and exposure to sunshine. These have been shown to be beneficial in limiting COVID-19 transmission and severe disease. In addition to our natural foods, we should emphasize plenty of fruits rich in vitamin C, such as lemon, orange juice, limes, tomatoes, pineapples, etc., and vegetables. Vitamin D is essential for reducing the severity of the COVID-19. It is therefore important that we add meat, especially beef liver, eggs, fatty fish such as Nile perch, especially the skin and the fish eggs, and all other sources of vitamin D in addition to exposure to the morning sun. The other sources of vitamin D are white beans, soya beans, soya milk, sun-dried mushrooms, and some vegetables such as spinach and okra. In light of the above, and with the guidance from the National Task Force and the scientists, the government has revised the control measures to address the current situation as follows. Number one, all schools and institutions of higher learning to close for 42 days, effective 8 a.m., 7th of June, 2021. This school should close from tomorrow, all of them. From tomorrow, 8 a.m., school should close. All the schools that had been open, the finalists, as we call them, as we used to call them at Kiamate, the goers, the ones who are going and would go with our collars up like this. We are goers. So the goers, please, for now, for 42 days, you go home. We debated this issue very seriously because there was a debate that, if they go home, these children are not going to infect their people. Yes, there's that risk, but the risk of staying together, is bigger than the risk of dispersal. Dispersing. The strategy here is to avoid concentrations. And you avoid concentration by dispersing. So, all the schools to close from tomorrow, 8 a.m. All teachers to fully get vaccinated before they are accepted in schools. All the teachers must be vaccinated. The other day I saw one of my competitors, one of the presidential candidates, Mr. Kabureta. I had not seen that man. I got a chance to see him on TV. I had not seen him, although we were competing, but we didn't get a chance to exchange. But I saw him saying that employers have no right to force somebody to be vaccinated. I beg your pardon. If we are in a workplace and for health reasons we say that this is required and you don't do it, please, you don't come. We may not force you, but we may not force you to take the vaccine, but you shall not come to the workplace. So, presidential candidate Kabureta, please check your list of rights. Yes, you have got your right to boycott the vaccine, but we have also got a right to protect ourselves from you. So any teacher who is not vaccinated will not teach. Should not be allowed in the school. Communal prayers in mosques, churches, or in stadia and other open-air venues are suspended for 42 days. Ekigambo ekyo banange, that issue, I don't know why some people were insisting on opening these churches and mosques. Really, I'm lucky I have a bishop in my house. For the first time in 150 years, I had never had a bishop in my house since Christianity came in 1877. But one of my daughters is a bishop now, a pastor, Patience Kokondeka, Ruawogo. When they were opening, she asked my opinion. I said, please, 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 Patience, don't open that church, because God is in all places. You preach through the radio. And I'm glad my home-based bishop listened to my advice. So this idea that you must be in the church, that God is in the church or in the mosque. I've got some fundamentalist people here like Musenero. Musenero is one of the fundamentalist Christians. Diana Twin is moderate type. I don't know the other fundamentalists, but Okia is also a fundamentalist. Okia, I had forced him to go for a master's because he had become a preacher. But he's doing more work now as a consultant. So you, please, I don't know where this idea came from of saying that God is in the mosque, that is in the church, because when I did my catechism, 1957, when I was in P5, in Runyankwere Catechism, they said, Rahanga Ryumyanya Yona. God is omnipresent. That's how they say it in English, omnipresent. So God, please, we'll hear you wherever you are. So please, this gathering our people, that when they saw such a clear danger, is not correct. So communal prayers in mosques, churches, or stadia and other open-air venues are suspended for 42 days. Online prayers are encouraged. public and cultural gatherings or conferences, except for the sitting of the cabinet, the legislature and judiciary, are hereby suspended for 42 days. We are talking of 42 days for scientific reasons, because when you get infected, the idea that that infection will show in 14 days, is that not the logic? That if you are infected today, ogenda okumala ennaku 14 obulwadde bunaaba buvuddeyo, the sickness will show up. So therefore, to be sure, the 42 days are 3 bisanja of infection. 14 days, in the case we didn't see properly, we'll give you another 14, that's 28 days. But to be sure, 42 days. That is 3 times. 28, 2 bisanja, 3, you go to 42. And actually, if people behave well, because this disease is very easy, it's actually easy to stop. It's very easy to stop. Like you have seen what happened. When we took serious measures, by December, there were no cases, almost. Up to March, up to April. We didn't have cases. And we have seen the elderly, when they avoid, the infection is now very low. So we can actually totally, because if somebody has got corona and he keeps to himself for 15 days or 28 days, it will be over. It will be out of him. And if it is out of him, he will not infect anybody. So that's why we talk of the 42 days. Travel from Category A countries, as defined by the Minister of Health, remains suspended except for returning Ugandans. At the moment, only India is listed as Category A. But that list may be revised by the Minister of Health as the situation evolves. Agricultural activities, which are cultivating or plowing gardens, herding livestock, whether free range or zero grazing, and fishing for fish, including fish farming, to continue. This should continue, because fortunately, most of them do not encourage crowding. Obulunzi, obulimi, obuvubi tebulina kizibu ky'amaanyi, kubanga abantu tebeekunganya nnyo. So those should continue. The non-agricultural activities that will be allowed to continue are factory activities, construction activities, shopping malls, supermarkets. All these to continue while observing SOPs issued by the Minister of Health. We were debating about these shopping malls and supermarkets, but I decided to give them a chance to see, okay, let's give them a chance for 1 week. If they observe the SOPs, then we can ignore them. But otherwise, there was an opinion that they should be closed, because they spread infection, because people gather there, And in any case, they specialize selling imported goods. Because they don't sell our own products. They sell imported merchandise. These gathering points, such as factories, hotels, large plantations, markets, taxi parks, etc., should be allowed to operate under strict observance of SOPs. So like in the factories, people should work, but should not be very squeezed. You discuss that with the Minister of Health. And people should be putting on masks. These must observe strict SOPs. Failure to comply within a week will lead to complete closure. Marriage ceremonies, parties, and all other social gatherings are only allowed with a maximum of 20 people. 20. Makumi abiri. Pierre Ario. 2020. Ishirini. Under strict observance of SOPs. House parties are strictly banned, and this would be enforced without fail. All guests, when you go to these marriage ceremonies of 20 people, wear masks and keep physical distance. Because you remember, I told you of the scientific wedding. I said, why do you bring all these people, all these irrelevant people, to the marriage? Because the marriage is just needed some few essential elements: future husband, future wife, two parents, two parents times two, that is 4. So flower girl, the priest, the matron. So all the others are just they don't have a particular role, just to see it and eat. Yeah, the best man and lady of honor. That's all you need. Number of persons at burials, vigils, and funerals should not exceed 20 people. All should wear masks and social distance. 11. Weekly non-food markets, known as Miburo markets, are suspended for 42 days throughout the country. 12. Also suspended for 42 days are the monthly cattle auction markets, Ebukomera. The danger with these markets is that people come from different places. You don't know where they have come from. They come together for some hours and then they go back. That's a perfect arrangement for spreading the disease. Come from 20 multiple directions, spend a day together, then go back. That's the best way to oxiga or to propagate the sickness. 13. All public transport, buses, taxis, border borders between and across districts are suspended for 42 days, effective 10th of June 2021. Public transport from district to district, inter-district, is suspended for 42 days from the 10th of June. This is to allow our children to go home, the students who were in the school. Otherwise I would have said immediate. But I give you 3 days, 4 days to operate, and then we shall stop them. All inter-district travel banned except travel within Kampala, metropolitan, Kampala, Wakiso, Mukono. Inter-district travel, stop it. Stay where you are. Don't go from Mbarara to come to Kampala to, no. Stay in Mbarara for 42 days. Don't come to Kampala and don't go from here to Mbarara, no. Exemption for inter-district travel and movement of vehicles are cargo trucks. Cargo trucks, the trucks which carry food, which carry cargo, those should move. Registered tourist vehicles also should move. Essential and emergency services vehicles. Public transport within the same district is allowed with strict observance of SOPs as previously described. So within Kampala, public transport will be allowed to continue operating. Some people wanted it to be closed, but I said no. How about the factories? How will the factory workers go to work? But all this is if they observe SOPs. Don't carry many people in the taxi, and so on. Put on masks, sanitizing, and so on. If they don't, we may have to suspend them also. Cargo trucks are allowed only 2 people. When it's a cargo truck, just 2 people, the driver and somebody else. Tourist vehicles must observe SOPs as spelled out. Bars, discos, music shows, cinemas, and concerts remain closed. Sports events will only operate under strict observance of SOPs with no spectators. All players must have negative PCR tests. So Abazanyi will be, can run and play football in the stadium, but without spectators. We can see them on TV. And I sometimes, when I'm looking for UBC and some channels, sometimes I see sports channels in Europe. I am here, I see people playing football in Europe. So you don't have to be in the stadium. If there is a danger, we go to the stadium when there is no danger. But if there is danger, why do we go? All public places, markets, offices, shopping malls are directed to maintain strict hygiene, ensure people coming in are sanitized before entry, physical distancing, and appropriate use of face masks all the time. Encourage people to work from home whenever possible and revert to 30% physical presence at workplace for 42 days. At my office, all these people don't have to come. For the office people, only 30% should come. Not more than that. The heads of the offices to organize that. For 1 month, so and so are the only ones who will come. Then after 1 month, you check the others and they can come and the other ones stay at home. Institutions, organizations, and workplaces to have persons dedicated to compliance. Each area to have a nyampara, to check compliance. Private vehicles should be restricted to not more than 3 people, including the driver. Private vehicles. The other ones are public. Private ones can move, but only with. But also the private vehicles, we don't allow them between districts. Even if you have got a private vehicle, we have stopped inter-district movement. So when I say private vehicles, I'm talking of within the district. Within the district. Inter-district movement is stopped for 14 days. Because you see, what you want to stop the infection. And whether you are one or in a government vehicle, a private vehicle, you can carry the virus. So stay where you are. Ambulances, security vehicles, and garbage collection vehicles are allowed to operate normally. Shopping arcades, hardware shops, and any other commercial entity to operate under strict observance of SOPs and must close at 7 p.m. countrywide. Failure to comply will lead to total closure. Owners and managers will be held liable for breach of SOPs. Exception will be given to pharmacies to operate beyond 7 p.m. The shops selling medicine, those will be exempted until the curfew time. As I said, supermarkets will remain open and operate with strict observance of SOPs and close at 7 p.m. Owners must enforce the use of masks and sanitizers in the workplace at all the time. The food markets should continue operating but enforce SOPs. The market leaders will be held liable for non-compliance to SOPs. Saloons, lodges, and garages are allowed to operate up to 7 p.m. with the strict SOPs. Lodges should be allowed to operate, but bars in these places should not be operational. Lodges without bars. And you know why we are against bars? Because drunkards cannot understand SOPs. I think if you want to get drunk, can't you get drunk in your house? Yes. I don't know why these drunkards really want to cause us a problem. Because if you want to get drunk, given the danger which is there, go buy the beers, take them to your house. And then you can drink, and you lie on the floor there. We shall not be there. Why do you want to gather? Factories are allowed to continue operating under strict observance of SOPs and where need arises work in shifts. Construction sites are allowed to continue under strict observance of SOPs. As I have said before, lorries should not have more than 2 persons. We shall continue to work with the EAC member states to strengthen cross-border surveillance. Private cars, as I've said, are allowed to cross the border into the neighboring countries, provided they observe SOPs and occupants have a negative PCR test result. Curfew shall remain at 2100 hours, that is 9 p.m., from 2100 hours to 5:30 a.m. and vigorously enforced, except for cargo, trucks, lorries, pickups, trains, and aircraft. For health emergencies during curfew, this will be dealt with by the security on the basis of the case-by-case basis. The RDC should take over in the rural areas. Border borders are allowed to transport goods and or one passenger up to 6 p.m. for the next 42 days. Failure to comply within 1 week will lead to complete closure. Enforcing directives and responsibility enforcing directives and the responsibility should lie with the owners of the premises with security. Violation of these measures will lead to fines that will be given out soon in a statutory instrument signed by the Permanent Secretary to the Treasury. So instead of arresting people and filling jails and wasting our time, this time, akasente, we thought, why do we waste time with arresting these people? You violate, you pay. And the Secretary for Treasury is going to issue a statutory instrument, and he will issue security-controlled receipt books. When you violate, bakuba kakonge, they give you a default ticket, and you go and pay in the bank. We don't want our people to touch money. Your number remains on the counterfoil, and you go and you pay. Secretary for Treasury will issue this statutory, because the ministers are not there now, but the Secretary for Treasury will do it. I will authorize her to do it. So, authorize him. Those who do not care about the health of Ugandans will pay financially. All the above directives, except where explicitly stated, take immediate effect. Government will continuously observe the compliance and make necessary adjustments. The enforcement of the above directives does not only lie with the law enforcers, but also the owners of public transport organizations, owners of premises, and individuals. If you fail to comply within 1 week, I will enforce total lockdown. In order to ensure this, I had set up a task force monitoring group headed by Major General Muhesi and including Dr. Musenero, but I think Muhesi had some, is indisposed. So I now appoint Major General Rusoke to work with Dr. Musenero to enforce. The other group of Major General Chanda was involved also, that those should go back to the army because they cause multiple things will cause confusion. So it is now Rusoke, Musenero, these are the monitors. And I authorize them to use the police network, our cameras, see who is violating. Because you can see. And then you take action. So I thank you, and I wish you good luck. But before I end today, although the talk is about Corona, I thought I should talk a little bit about security also. The other day at Kororo, I talked a bit about security, but I was talking about many things. But I have been reading papers, and I saw some people writing, especially in the Monitor. That Monitor has got all sorts of very confused people. One of these days I will answer them. I actually picked one of their papers some weeks ago and kept it. And when I have time, I will answer them. Now, when they are dealing with the security, they now want to spread pessimism and worry about security. And from what I could see, they were making 3 points. Point number one was, these people who are killing people, who have been killing people even in the past, investigations are done, but they are never completed. That's one line. Then the second one is with the shooting at Katumba recently. Oh, a whole general has been shot. If a whole general can be shot, how about us? How about us? It seems the situation is very bad. Situation is very bad. Because if a whole general can be shot, then how about we? So I think we should run away and go to Nani. I don't know, go where. Then thirdly, now this one I saw, I think it was yesterday or today, I saw it in that bad paper called Monitor. So, the elite, the elite are not sleeping. They are worried about their security. In the past, the elite ran away out of Uganda, but now they're in a dilemma. They don't know where to run away because they have a lot of property. They don't want to leave it here. So they are like the hyena. The hyena, one day the hyena was swallowing a hot something. It was hot. It couldn't swallow. Then somebody said, okay, if you can't swallow, then you spit. So it couldn't spit because it was sweet. It couldn't swallow because it was hot. So the Monitor was saying that the elite are now stuck because they have a lot of property, but they are worried. They want to run away, but if they run away, how will they leave their property? Now, before I speak, I brought one of my fighters, because I normally have abarwanyi banange, olwakarwan kanange getwarwana entaro, njagala otegeza abantu bano engeri gye twarwanamu. Yogera mu Luganda by'oluzungu bireke bisitawanya, oluzungu lwatukoye nalwo.
Nayanza mzee amanya nze nakyambadde rest abajjukira emboozi ey'ebijambi e Kalungu yenze. Njagala okwebaza muzeeyi ku nsonga ya security. Ekintu kya General Katumba ekyabaddewo mu butuufu nga kyeraliikirizamuko, naye ate twebaza Katonda nti kati nze nga ku nsonga yange ebyaliwo ebijambiya, abakyamu basobola okukola ebintu naye tebajja bikolera lubeerera. Ekiseera kyabwe kituuka ne kikola ki? Ne kiggwako. We tutuuse kati mu Uganda, security si yeeraliikiriza ennyo kati we tuli. Njagala okugumya bannayuganda nti ku nsonga ya security nze ndi mugumu, olw'ensonga nti omukulembeze gwe tuyina ebintu biyinza okuba nga ebitambula empola oba abakyamu bakola bye bakola ne babula, naye buli badde era balikwatibwa ebintu bino biriggwawo. Ani yali amanyi nti e Kalungu ebijambiya birikoma abantu ne beebaka ku tulo? Ekiri e Kalungu olwaleero actually okuva lwe bakwata ab'ebijambiya bakidde balime ne group ye, abantu kati abeetema beetemera bibanja bintu birala naye ng'abantu beebaka. Si kyekiri ekyaliwo, kyasemba ku nze, teri kyakizeemu kubeerawo. Kati olw'okuba nti ebitongole by'obukuumi bikola omulimu gwabyo tuyinza obutabitegeera ffenna nga bannayuganda kyekigenda mu maaso naye nze ndi mugumu nti n'abalumbye General Katumba yadde bayinza okuba bakola mu nkola yemu basse n'abantu abalala mu ngeri bwetyo afande Kaweesi n'abalala naye era tubeere bagumu na kino kijja kuggwa.
Tubuulire
ekyaffe waliwo gurupu y'abavubuka baali babiri e Masaka eyo naye mu kusooka era nga bannayuganda bwetuteebereza abantu baali bamanyi nti kibinja ky'abantu bangi nnyo. Gwali mwezi gwa kutaano kyali kiro lwali lwa Mande nze nali mu nyumba nga neebase.
Mwezi gwa kutaano mwaka ki?
2018 nali mu nyumba kiro nga neebase. Mu nyumba twalimu abantu babiri nze n'omwana omuwala omulala kubanga ennyumba ya project awo we nali mbeera nga tulimu abantu babiri nsula ludde eno naye asula sayidi eri. Ngenda okuwulira omuntu alinga akwata ku luggi olw'emiryango. Omukamera naye yanze okusa Katonda yeewuunyisa nazuukuka n'essimu yange nga ngikutte mu ngalo bwe nti nsale nzire mu kisenge ky'omwana ndabe yafulumye wabweru gwe mpulira ebweru. Okusala okudda mu kisenge ng'omuntu wona otunula nti wabanga omulyango gw'emiryango mu ggulu omuntu yafulumye nga ndaba kateni buli kimu kiri bulungi natuukira mu kisenge ky'omwana okubikula kateni nze namuzuukusa okubikula neeti nze nagijjayo ne muyita Susan ne mubuuza essimu yerwa kubanga nalengera omuntu nga flashinga torch bwenti kati nalowooza oba afulumye na ssimu ne mubuuza essimu yerwa n'agindaga n'omutima gwe ne gungambirawo nti kati ebweru babbi. Ne mugamba tukubire neiba waffe maaso nangamba musawo siinaako airtime nenkwata eyange nenkubira neiba wange andi maaso ng'essimu ye teriiko nenkubira omwami omulala bamuyita mwami Mugejja neiba wange waggulu ne mugamba tata Mati ninyamba ndaba abantu ewange naye balabika babbi. Nzijjaako naye n'ennamba ya Osi mujagala omukubira tata Mati anziriza ambuuza musawo kiki kati nasooka kukwata tata Mati naye ngendo gikwata ng'olompulira emiryango endabirwamu ziyiika oluggi ng'endabirwamu bagikubi kati nakwata bukwasi essimu n'enkuba nduulu nga ne tutandika okuba enduulu nkuba enduulu nnyo ng'omutima gwange guŋŋamba bwe bawulira nti tukuba enduulu bagenda naye ngenda okuwulira entebe mu ddiiro bazisindika ne mmanya nti kati bayingidde essimu n'enjijjako saagirinda nakuzikirira ddala n'enjisa mu ddirisa n'engisuula ebweru ngenda okuwulira nga basamba oluggi lw'ekisenge lwe twalimu kubanga bwe mmanyi okumanya nti babbinzira ku luggi ndusiba. Essimu ngisula yansanga sinalyayo na mukono bwenti mu ddirisa naŋŋamba oleekaana kisirika njagala ssente nentambula nabo nenzira mu kisenge kyange. Bwe nzira mu kisenge kyange nabo nayina ensaawo gye nali nkoze nayo zino zituuka ku mugongo mulimu ID n'ebintu ebirala nzijamu emitwalo 2 n'ekitundu kubanga gye gyalimu njibawa ne baŋŋamba osaaga gojja kuleeta ssente ne mbagamba ze nnina ne bagaana ne basooka ne bakebera ne banoonyanoonya akaawo naye ng'omutima gundi wabweru essimu gye nakubye oba gwe nagambye yakitegedde simanyi. Banoonyeza Kidawali Mesawo n'agibuka ku mugongo n'ateekamu ebiri gye ne bafuluma. Bwe bafuluma ndowooza bagenze neesibirayo mu kisenge nyingira wansi w'ekitanda kaseera katono nnyo ngenda okuya bakomyewo ku luggi bakonkona ggulawo oli n'amugamba oba afulumye nti amwali yeesibiddemu ngenda okuya nalo balusambye yasamba ogusooka n'enfulumayo n'ennyingira mu kinaabiro kisenge wano kinaabiro n'ensala n'enzira mu kinaabiro nga sikyalina nawakwekweka. Kati bwe bayingira era yasooka kumunisa wansi wa kitanda nga manyi gye neekwese mbalengera mu kinaabiro nyimiridde baŋŋamba olemedde ssente naye wano mu kusooka nga tebannafuluma kisenge kyange banoonyeza zibabuze awo nange nnoonya ensawo nze nazeetinkuulira ebitanda emifaliso n'engikyusa nga mbagamba ne wano nterekawo ssente neeno naye nga ngulabudde abajja basobole otutusanga. Bwe nyingira mu kinaabiro bayingidde Kidawali baawanyisanga ekisenge eri gye bansanga balowooza bagye nali nterese ssente kuba kyo bakitinkula nnyo n'okusinga ebisenge byonna. Ono bwakusigalako ssente ozigaanidde ogenda kufa toli musawo musala abantu leero nze ngenda okusala. N'oyo n'agenda Kidawali nadda kagali akalala gali wangu nako ne kadda bwe batyo. Kati Kidawali aba ansigaddeko angamba ogaanidde ssente kale weeyambule. Nali ndi munayi nangamba jamu empale neneebikula nangamba bikula yayina essimu nene bulungi nnyo atandika okuba ebifaananyi bw'angamba kyuka amala ngamba jangu nve mu kisenge mu kinaabiro we nali nzire mu kisenge lwali lwa Monday tuva mu weekend na nitaddeko ensonga yange etukula enkuba yali tonnya wabweru batambula n'ebigatto kati nga ebigere wansi bikyafu ntunuulira obuliri bwange bwe ŋŋendako mugamba kannaabeko ebigere naye nga wonna kubuzaabuza n'ayimirira naninda kati awo tuwulira omuntu wabwe ng'atambula alinnya mu bigiraasi emiryango Kiddawalima ayita afande okumalayo afande omulundi ogwokubiri ne tuwulira essasi wabweru n'anta omukono n'afuluma awo nawulira nga mpulira ninga abadde aloota nga ninga abadde abbira nga nvaayo bwe nti naye nga nninda nga ŋŋamba agenda kukomawo agambe tufa bameka tufa babiri kati awo amasasi geeyongera wabweru geeyongera Kiddawalima bwe yagenda teyadda nasigala nyimiridde mu kifo kimu bwe nti nga ŋŋamba oba akomawo teyadda amasasi ne geeyongera wabweru kati bali be nali nkubidde obaali bakubidde osi aze n'abasirikale abalala gali wangadduka mu kavuyo ako basigaza Kiddawalima bamukwata osi yajja n'omwami mula crime preventer kyakuwa nga bakwata Kiddawalima naye yabalwanyisa yalwana agezaako okudduka agezaako okubuuka akatimba naye mukama wakisa ne bamukwata abantu olwo beeyongedde omwami no genda kubira abantu bonna awo kubanga abantu baali bakooye kati yakubira abantu kubanga gwali mulundi gwakubira okomawo ku kyalo abantu bonna ne bajja kati nze ngenda okufuluma nga mpulira Kiddawalima akaabaleeka nafande ensonyiwa afande ŋŋonze naye nga mpulira eddoboozi limu siwulira lyakubiri nzira mu ddirisa nga ŋŋamba afande bali babiri tali omu nga baŋŋamba omu adduse awo bwe nfunira amaanyi agafuluma bwe natuuka ku Kiddawalima namukuba ebikonde nga mpulira tebimunogana bulungi kuba yali mukambwe oli simanyi nakumanya naye okumutuukako nga wansi amagulu takya eno waggulu nga gyasitula ng'amagulu wansi takyanyeenya olwo abantu beeyongedde ab'amayinja abakola ki ate omutima munda nga musajja bagenda mmuttira muno munda njagala ogamba bane bamufulime wabweru ng'abantu amaloboozi mayitirivu nga tolina nawo okiyisa fayinaale mayinja biki ne bamukuba n'afiira awo bw'amala okufa osi amugjamu amukuba ceeka amugjamu ekipapula nga kiriko ebifaananyi byabwe bibiri kuba baali babatimbye endooza Masaka muno bakino bakitimbula wasimanyi nga Kiddawalima kirina mu nsawo kye kiriko wanted omusirikale n'agamba bano si be baana abatoloka mu kooti e Masaka emisana be banoonya n'akindaga bwe nti kuba amataala gaaliko mu nnyumba nga nabalaba bulungi ne mugamba be bano kati ku bantu be baali babba omulundi ogwasooka baaliwo ne babalaga omwami mu n'agamba be bano abaana abanziba omulundi ogwasooka awo omusirikale n'atandika okukuba amasimu ne bakuba ekalungu abo prison ne bajja ne bakonfaminga nga ye Kiddawalima bw'atyo mukama bwe yansaasira
oli
eyadduka oluvannyuma lwa wiiki emu bamukwatira ntuŋŋama eyo
yes so therefore thank you very much.
Welcome, sir.
This is my co-fighter the Chambadde. You can see this Kiddawalima group are the people who had killed 5 people on New Year's Day. Ya New Year's Day ya mwaka wa 18
2017 as we are entering 2018.
So this group, this fellow Kiddawalima, who was killed trying to rob and rape her, had been involved in killing 5 people on New Year's Day of 2018. There had been a disco. You know, Ugandans have been used to esanyu, to laxity. So there was a disco in Kisojo there. Is it Zimbabwe or what? Or Komansimbi? Now, during that New Year's Day, when there was a lot of music, they came to rob a wife of a school owner. School owner had a husband who was working in Mbende. She was a woman. And because there was a lot of disco, they were making alarm, but nobody was hearing them. But somehow one of the boys came, and the group which was trying to break into the school owner's home ran. But as they were running, they killed 5 people on the way, including a former police officer whom they invaded, and he tried to fight and they killed him. So that group continued terrorizing the massacre area. But they were doing it using laxity. You see, for instance, when the school owner, whom they tried to rob, instead of ringing the police, she rang her husband in Mbende. Her husband in Mbende rang the regional police commander in Masaka. Regional police commander is the one who rang the police in Bukomasimba, I think it was. And by that time, these people had left. But because of the literal scuffle, you see, that's why people shouldn't really exaggerate the problem of criminals, because they will be defeated. But in their going, they dropped a phone. And from the phone, the police were able to get other things, to know that this was some of them. But still, the issue was not solved. But what happened was that this time, we organized the area to say, now, if the criminals come, you don't ring far, you ring the DPC nearest to you. Don't go too far. Now, that's what she did here in Nachambade. When she was attacked, I think because of the sensitization, she ran one of the security of the local leaders, including the OC police. And as she was still fighting with them, they came. And that's how the whole group was wiped out, the whole group of Chidawarime. So the line of the unending of crimes which are never concluded is not entirely correct. I have a report here by the CID. It has got all these cases, like for instance, many cases here of what has happened and what has a total of 68 cases have been identified, including these murders, and many of the people have either been killed, some of the people have been killed, like the Chidawarime group. Like for instance, okay, let's take the case of kidnap and murder of Nagirinya, Maria Gateni, and Kitayimba Roni. You remember the girl called Nagirinya who was kidnapped and killed in Mukono? Before killing the victims, the suspects obtained their mobile money PIN numbers of the 2 victims. They later withdrew Uganda shilling 260,000 from Nagrinya's mobile phone, number this, and from Kitayimbo's mobile phone. So eventually these people were caught. The following suspects were taken to Mwanga 2 court on 29th March, 29th September, and remanded to Zira. These are Kasoro, Koporiamu. Then you have people like Jumba Mulunda. Then two AK-47s were recovered, and so on and so forth. Then you. So what I will do, I will tell Grace Akulo to publish, because this is the case of Nagrinya, this is the case of Chidawarime, the ones who killed the 5 people at Kisojo. And what I will ask Akulo is to give the country a brief about all these murders, even the killing of Joe and Kagezi. The killers were identified, but some were abroad, and they were supposed to use the Interpol to look for them. So that line that all these cases never end, are never concluded, is not wholly correct. This is number one. Now, number two, General Mramba, if he can be attacked, how about we, the ordinary people? The general, if he's not alert, and the population is not alert, can be attacked. Because you must have heard that the generals have blood, unless you have discovered that the generals don't have blood. But if they have blood, they can be attacked. Now, in the case of Katumba, he had also made mistakes, because apparently he was moving without a follow car. That he used to have a follow car when he was CDF, but when he became a minister, he was not moving with a follow car. He was moving with one escort and with a driver. Now that one was, I didn't know that because a 4-star general, given that we still have some of these isolated incidents, he should be having a follow car, and now he has it. Because if he had had a follow car, that one would not, it would not have been easy to attack him. But even then, the bodyguard reacted, and that's how he chased away the killers, and 2 people died, but he saved himself, the bodyguard, and the general, although he was injured. But when something like this happens, it is because the whole country was relaxed. They were not like when we got mobilized with Nachambade there, and now we are now mobilized. Like, for instance, these fellows who attacked Katumba, actually they met a traffic police, but the traffic police was not armed. He tried to stop them, they ignored him, they passed. So you can see now, these people are using our laxity, our peace, to commit crime. But as Nachambade said, when you provoke us and we wake up, what will you do? Because we shall eventually get you. Now, the traffic police are going to be armed. So you no longer come and pass by the traffic police like they did. They will be armed now, or they will be paired with armed people. You try to pass, they shoot you. So therefore, it is not not correct to say the general, because therefore, it is because there were weak elements in the security of the general that this happened. But it cannot continue. It cannot continue. We shall react. During this time of that insecurity, when they were killing women in Entebbe, killing women in Nansana, you remember those killings? We mobilized LDUs. They were attacking factories. They wanted factories, I think, to close. We mobilized, and guarded all the factories. LDUs were everywhere, and the crime was defeated. So therefore, the story by the Monitor that the people are worried, the elite are worried, please, yes, they may be worried because of your misinformation, but I'm telling you that we shall defeat this insecurity like we did it in the past. And I thought I should alert you on this. So my comrade Nachambade, when she became a hero, I looked for her in, is it Karungu? And I recruited her. She was a nurse there, local nurse. I said, you come and be nurse of special forces. So she's now one of my warriors. I normally find her at VIP checking corona and so on. So I thought she should come and give you her testimony of how insecurity was stopped in the Masaka area by getting rid of the Chidawarime gang. They were all either killed or arrested. I thank you. Good night.
Thank you so much, and welcome back from that address from the President at Nakasero. And time is actually running up. We're just counting about 7 minutes to 10 o'clock. And we also need to set stage for our next bulletin that is coming on at 10 o'clock. But remember, with me in studios are two experts, two doctors, both with PhDs, Dr. Joyce Moriku Kwaduchu and Dr. Chris Variomunsi. Dr. Variomunsi, the President has said it all. We are back into that partial lockdown. Well, you've heard him. I don't know what to say and what not to say.
Yes, I saw it coming myself.
You saw it coming.
I want to thank the President because he has been very clear. And like we have already said, these measures may be inconveniencing, but necessary.
Life-saving.
Because if we want comfort and allow the spread of COVID-19, then we may enjoy that comfort to the grave. So my message to Ugandans is really, as the President has emphasized, let's comply with the measures, painful as they may be. They will affect our businesses, our movements, but I think let us observe them for the next 42 days as directed. I'm sure if all of us get disciplined, we shall be able to disrupt the transmission cycle of this COVID-19, and then we should be able to see reduction of the infections. And he has also further warned that if we remain relaxed, then there's a possibility for a total lockdown.
Which wouldn't want to get into.
Which wouldn't want. Because people were worried. Everybody was calling, are you going to close us tomorrow? Are you going to close us tomorrow? Now that we are not completely closed, I think let's observe these measures and take that responsibility. Because much as police, security officers, enforcement officers may be there, but the best person to police you and I is you yourself.
Exactly.
Because basically we're talking of avoiding contracting corona. It becomes a personal responsibility.
Okay.
Nobody will force you to put on a mask. Nobody will, yes, you will be forced. Nobody will force you to wash your hands. But I think
to sanitize.
If everybody knows it is his or her personal responsibility, then I think we should be able to reach far.
Okay.
I was in Malaysia a few weeks ago. They're extremely strict. I went there as a minister. They put me in the quarantine for 7 days. And they had to monitor my movements. And for them, they told me, if they find you in public without a mask, they have fines. You are fined to pay an equivalent of 10 million Uganda shillings.
In ringgits? In
Malaysia, yes, in ringgits. In their local currency, ringgits. But in Ugandan shilling equivalent of 10 million, yes. If they find you in public and you're not wearing a mask. So it...
and the mask costs only 1,000 shillings?
Absolutely.
So you pay that so many times?
The fine which the president has announced that there will be a statutory instrument, I hope it comes out tomorrow and it is enforced so that people know that it is very serious. It's very serious. So I think the message was quite comprehensive, and I hope that all of us Ugandans will comply with these measures and so that we reverse the trend of infections which is worrying in the country.
Dr. Kaduji,
yes.
Finally from you, in a few minutes, you've had the president speak to us, and that's where we are now.
Yeah, I think I want to thank the president for these strategic directives he has given. The fact is that by the time the president comes to give these directions, he has analyzed it critically. There's some evidence-based information, scientific data that they've put together with the National Task Force, with the scientists, to really analyze what is the implication of this information, what is the implication of these statistics as he read. Like just in one day alone, when we have new cases up above 1,000 and 9 people dying on that day. So I just want to request the people of Uganda, by the time the president comes to give this kind of strategic directive, is really based on evidence, science, and information that is available. In line with that, we should know that we are not in a normal situation.
Very good.
This is an abnormal existence. This is like we are in the war. And for that matter, one of the most important aspects is for us to change our attitude, our behavior. We really need to look at these things in a different way, to try to adapt and live in this abnormal situation, but cope up and live in a normal way. So what I want to say to the people of Uganda is that, yes, there are really stringent measures that have been put in place. The whole thing is, at the end of it, we want to preserve life. We want to see that we do not lose many people because of this virus. We want to slow down the infection rate and ultimately really to reduce it in the circulation. Because as of now, the entire Uganda is saturated with the virus. Every district, their virus. So that is the ultimate solution for us, really. These directives are given because of the reduction and slowing down. So finally, let's change our mindsets, let's change our behavior to embrace these things that are not friendly, culturally it's not our culture. For example, to keep the face mask. And it is time for us to use the face mask consistently, correctly, and every time. They are not for decoration. They are not to be put for handkerchiefs in the pocket. They are not to be put in the bags, but they are there to prevent infection. Let's try to get used and put hand washing facility in every home state. And I think he has made it clear. We have the existing structures in the system, in the government. If we have the LC system, we have the women leadership, the cultural leaders, the religious leaders. Everybody can play your part such that let's all come together to fight this and take it as a personal responsibility. Be it a mother, a father, a child, whether you are a minister, you are a peasant farmer, but life is all precious and they're all gift of God. Finally, let's not forget to pray, because we are God-fearing country, and I think all of us are subjected to pray. We need to really offer this country into the hands of God, the leadership, the people of Uganda, so that we really ask God
to save us,
to have divine intervention.
Exactly.
And at the end of it, I think miracles can happen.
They can happen.
Maybe one small comment again.
Yes.
Because the president said the teachers, once they reopen the schools, who will not have been vaccinated,
they shall not be able
allowed.
to teach.
Just to reassure, I was in Kanungu and I met a teacher who was scared of the vaccine. I asked him, have you been vaccinated? He said, no, for me, I'm skeptical. I said, but I'm a doctor. And a senior one at that, I have been vaccinated. So just to assure the public that the vaccines which we are giving the people are safe and efficacious. They actually a difference between death and life. They can save you, they save lives. So there is no reason whatsoever why anybody, teachers and other Ugandans, should fear to get vaccinated. I know there are lots of rumors and falsehoods which saturate on social media, but we are doctors. We have been vaccinated. Herself has been vaccinated. I have been vaccinated. The president has been vaccinated. If we had any reason from a scientific and scholarly point of view to think that the vaccines are not safe, we would have dodged them. So teachers out there, health workers, security officers, and all Ugandans, let us embrace vaccination. When you get the chance to be vaccinated, please take the COVID jab. That is the only way we can chase this corona out of Uganda.
I want to thank both of you doctors, Dr. Chris Mariomunsi and Dr. Joyce Moriku Kaduchu. Thank you so much for being allowed to be with us here. And I think back to the people out there is we have gotten ourselves back to this position. We could do the best to avoid getting here, but we've gotten ourselves here by being complacent and not observing the SOPs. And we still can get ourselves from this partial lockdown to a more difficult situation of possibly a total lockdown. But you rather stay at home because the president has guided and directed, as opposed to staying in a hospital, staying in an HDU or an ICU or anything like that because you have COVID-19. So it's not the best that we want for all ourselves, but life is ultimate, that even those in hospitals are grappling and struggling to have another chance to live again. So if you have the chance to live, utilize the chance, use it. Let's do the best that we don't get to worse situations. We all want to be alive and we all want to enjoy this life. Remember, it's just one life to live, and it's one life to live. You live it now or you live it forever. So that's where we are. We want to thank you so much for being with us here on UBC TV, and just let you know that it's 10 o'clock already, and we should stay at stage 4, bulletin that is coming on next. My name is Jagan Asemakula Ziksoka, wishing all the best for God and my country. Good night and stay blessed.
Ekya COVID-19 kijja kugwa. If we get vaccinated now,